Ever get sticker shock from a medical bill?
Oh, yeah.
Like you see a charge for something that seems totally basic and wonder how it could possibly cost that much.
Yeah.
Well, get ready, because today's deep dive is going to make you rethink one of the most commonplace things in hospitals.
Okay.
Saline solution.
Interesting.
Yeah, that simple saltwater 5 drip.
Hmm.
We've got reports of insane price markups,
Oh.
global shortages, and you're going to be amazed at how complex the story of this basic medical necessity really is.
What's wild is that most of us probably never give saline a second thought. It's just there in the background.
Yeah.
But when you start pulling on that thread, you realize it's tangled up in this whole web of healthcare economics and logistics.
Okay, so let's untangle it before we get to the drama.
Yeah.
What exactly is saline solution?
Yeah.
And why is it so crucial in a medical setting?
Saline solution is basically sterile water with a precise amount of sodium chloride, IKK table salt, mixed in.
Gotcha.
It sounds simple, but it's a real workhorse in healthcare.
Really?
We're talking replenishing fluids for dehydrated patients, delivering meds intravenously, even irrigating wounds during surgery.
Wow.
It's involved in countless medical procedures.
So it's pretty fundamental.
It is.
But then we get to these reports about hospitals charging an arm and a leg for a bag of it.
Yeah.
We've got this analysis from Goodbill.
Okay.
And some of the prices they found are just mind-blowing.
Yeah, Goodbill's analysis uncovered some shocking examples.
Like what?
They found one hospital in Florida charging over $26,000 for a single bag of saline.
What?
And another in Oklahoma billing nearly $7,000.
Seriously?
These are prices you'd expect for like a complicated surgery,
Right.
not a bag of salt water.
Wait, $26,000 for saline?
Mm-hmm.
That's more than some people make in a year?
I know.
How is that even legal?
Right.
I thought hospitals had to be upfront about their pricing now.
Right. There's this thing called the Hospital Price Transparency Rule,
Okay.
which went into effect a few years ago.
Yeah.
It's supposed to make it easier for patients to understand costs.
Right.
Hospitals are required to publish their prices,
Mm-hmm.
but it turns out there are loopholes.
Loopholes.
Yeah. How so? Well, even though the prices are technically public,
Yeah.
hospitals can be pretty sneaky about how they present the data.
Mm-hmm.
It can be super confusing for the average person to decipher.
Oh, wow.
Goodbill's analysis actually showed that there can be huge price differences for saline,
Really?
even for folks with insurance.
Hmm.
For example, the median price for insured patients in Oregon was almost $70,
Okay.
but in Utah, it was under $3.
Wow.
It's crazy how much variation there is.
So even with this transparency rule, it's still a total guessing game for patients to know what they'll actually end up paying.
It is.
That seems kind of pointless.
Yeah, the system is still really opaque.
Right.
This makes it almost impossible to comparison shop or anticipate out-of-pocket costs,
Right.
even for something as basic as saline.
Wow.
And what's worse is that this isn't a new problem.
Really?
The New York Times actually did a big investigation into saline markups back in 2012,
Okay.
and they found similar issues.
So this has been going on for a while.
It has.
So despite all the attention this problem has gotten, it seems like it's still going strong.
It is.
Okay, so we know saline can be ridiculously expensive,
Yeah,
but WHY,
right.
who's pocketing all that extra cash?
That's the million-dollar question, right?
Yeah.
The New York Times article dug into this,
All right.
and it turns out there's this whole system of middlemen involved in getting saline from the manufacturer to the hospital. You've got these massive group purchasing organizations, or GPOs,
Okay.
which are basically buying groups for hospitals.
Right.
They negotiate contracts with suppliers.
Okay, so they're like bulk buyers
Yes.
trying to get a better deal.
Exactly.
Okay.
Then you've got distributors who act as the go-between, actually buying the saline from the manufacturers,
Yeah.
storing it,
Okay.
and then shipping it to hospitals.
Gotcha.
And each of these players adds their own markup along the way.
Hold on. So the hospitals are saying they have no control over the price.
Well,
They're just stuck paying whatever these middlemen decide.
it's
Doesn't seem right.
definitely a complicated situation. I mean,
Yeah.
these GPOs and distributors do provide valuable services.
Yeah.
They help hospitals get large volumes of supplies
Right.
and manage their inventory.
Yeah.
But because there isn't a lot of transparency or
Yeah.
competition in the system, it
Yeah.
creates the perfect environment for inflated prices.
It's like a rigged game.
Kinda.
It's not that hospitals are totally blameless,
Right.
but they're often stuck in a system
Yeah.
that doesn't exactly reward cost effectiveness.
Exactly.
So it sounds like the patients are the ones getting squeezed in the end.
Yeah.
Like they're stuck paying inflated rent in a healthcare monopoly game.
It's a good analogy.
Yeah.
And unfortunately, the crazy prices are only one piece of the saline puzzle.
I know.
We've also got to talk about the issue of shortages,
Oh,
which have been impacting hospitals all over the world.
yeah, we have this article here about a shortage that hit Australia just this year in 2024.
Oh, wow.
It says that a spike in demand
Yeah,
and manufacturing issues are the main culprits.
that's right. Okay.
Australia, like many other countries, relies heavily on imported saline, and that makes them super vulnerable to any disruptions in the supply chain,
Yeah.
like the ones we saw during the pandemic
Right.
or from natural disasters.
Of course.
When these things happen, hospitals are left scrambling to find alternatives.
The article mentions that the Australian Therapeutic Goods Administration had to step in
Oh, really?
and approve saline brands that weren't registered in Australia just to keep up with demand.
Wow.
Doesn't that seem a little risky?
Bringing in stuff from who knows where.
It definitely highlights the risks of depending solely on overseas manufacturers
Right.
for something as essential as saline.
Yeah.
Experts in Australia have been raising the alarm about this and calling for more government support to boost domestic manufacturing.
That makes sense.
Not only would that make their saline supply more secure,
Right.
but it could also be a boon for their economy.
So it's a wake-up call that healthcare security
Yes.
is tied to national security in a big way.
It is.
But hold on, if hospitals run out of saline, can't they just use other types of IV fluids?
Well,
I mean, there are other options out there, right?
it's not quite that simple.
Okay.
While other IV fluids exist like glucose solutions,
Yeah.
they can't always be swapped in for saline. It all comes down to the science of how these fluids interact with our bodies.
Okay.
You see, our blood has a very specific concentration of stuff dissolved in it,
Uh-huh.
what we call solutes.
Right.
And when we inject fluids intravenously, we have to be careful to match that concentration.
I see.
That's where this concept of osmosis comes into play.
Okay, back up a sec.
Sure.
Osmosis.
Yeah.
Remind me what that is again?
Osmosis is basically the movement of water across a membrane
Okay.
to balance out the concentration of solutes on both sides.
So like if there's more stuff dissolved in the fluid outside a cell,
Yeah.
water will move out of the cell to try and even things out.
Exactly.
And if there's more stuff inside, water will rush in.
You got it.
Okay.
Now imagine what happens if you inject an IV fluid that doesn't have the same concentration as our blood.
Okay.
If it's too concentrated, what we call hypertonic,
Right.
it'll suck water out of our cells,
Oh, wow.
potentially making them shrink and malfunction.
Like putting a raisin in a bowl of salt water.
Exactly.
All shriveled up.
Perfect analogy.
Yeah.
And on the flip side, if the fluid is too diluted or hypotonic, it can flood our cells with water, making them swell up.
Oh, no.
In extreme cases, they can even burst.
So saline solution, because it's formulated to match the concentration of our blood,
Yeah,
it helps keep everything balanced and stable.
exactly.
Okay.
That's why it's so important to use the right type of IV fluid for each situation.
Right.
It's not just about delivering fluids, it's about maintaining the delicate balance within our cells so they can do their jobs.
Wow. It's amazing how much science goes into something as seemingly basic as an IV drip.
It really is.
Yeah.
And it highlights why these saline shortages are such a big deal.
Right.
You can't just swap in any old fluid and expect everything to be fine.
So what are hospitals doing to cope when they're running low on saline?
Right.
They can't just stop treating patients,
Of
right?
course not.
Okay.
Hospitals have had to get creative and come up with various strategies.
Like what?
Although each workaround usually means more complexity,
Okay.
more work for staff, or higher costs.
Gotcha.
One thing they're doing is rationing saline,
Okay.
making sure the most critical patients and essential procedures are prioritized.
Interesting.
Pharmacists are playing a huge role in monitoring inventory and making sure every drop counts.
So it's like wartime rationing,
Yeah.
but for saline,
Yeah.
what other strategies are they using?
Some hospitals have switched to using different types of infusion devices
Okay.
that allow them to give smaller, more controlled doses of fluids.
I see.
This can help conserve saline when administering certain medications.
Gotcha.
And for some meds, they've moved to giving direct injections instead of using an IV drip.
Why?
Although that can take up more of the nurse's time
Yeah.
and isn't suitable for every drug.
Okay.
They're also looking into premixed products,
Okay.
where the medication comes already diluted in the right amount of saline.
Oh, interesting.
This cuts out the need for separate bags of saline
Right.
and reduces the chance of mixing errors.
That makes sense.
But of course, these pre-mixed options are usually more expensive.
It seems like every solution comes with some kind of trade-off.
Yeah.
Whether it's increased complexity.
Yeah.
More staff time
Yeah.
or higher costs.
That's the reality of managing healthcare resources, unfortunately.
Right.
When you're dealing with a shortage of something as fundamental as saline, tough choices have to be made.
Okay, so we've talked about these wild saline prices and the global shortages impacting hospitals.
Right.
It's clear this isn't just simple salt water.
Yeah.
It's wrapped up in a much bigger story.
It is.
But what does it all mean for us, the patients?
Yeah.
Why should we care?
If you zoom out and look at the bigger picture, the saline situation is really a microcosm of all the hidden complexities and vulnerabilities in our healthcare systems.
Right.
It raises some big questions about price transparency, the influence of middlemen,
Yeah.
and the importance of having strong local manufacturing so we have essential medical resources when we need them.
Right.
It's a good reminder that even the most basic things in healthcare can have these fascinating stories behind them. It's definitely made me rethink my assumptions about what's going on behind the scenes at hospitals.
That's the beauty of a deep dive, isn't it?
Yeah.
You start with something seemingly mundane and end up uncovering all these interconnected issues and potential solutions.
Okay, so we've covered the basics of what saline is, those crazy prices,
Yeah.
the global shortages,
Right.
the science behind why it's so important, and even some of the ways hospitals are coping.
Yeah.
Anything else we need to unpack before we move on?
You know, there's one more point I think is worth highlighting.
Okay.
It's about the role of us, the patients, in this whole equation.
Okay.
We've talked a lot about hospitals and governments and manufacturers.
Right.
But what about the people on the receiving end of healthcare?
Yeah.
What can we do?
That's a great point.
Yeah.
We've been focusing on all these big systemic issues, but what can we as patients actually do about this situation?
Right.
It feels like we're at the mercy of these giant forces.
It's easy to feel powerless for sure,
Yeah.
but I think there are a few things we can do.
Okay.
First off, we can be more informed healthcare consumers.
Okay.
That means understanding our rights when it comes to pricing transparency, asking questions about our bills,
Right.
and even shopping around for different providers if possible. We need to know the costs and what alternatives might be available.
So it's about being proactive,
Yeah.
not just blindly accepting whatever price the hospital throws our way.
Yeah.
Like, hold on a minute, $26,000 for saline.
Right.
Let's talk about this.
Exactly.
And speaking of knowledge,
Yeah.
another important thing we can do is educate ourselves
Uh-huh.
about the medications and treatments we're receiving.
Right.
Understanding why we need a particular IV fluid, for example,
Yeah.
can help us have more informed conversations with our doctors and nurses.
It can.
So it's not just about blindly following doctors' orders,
Right.
but understanding the why behind the treatment.
Exactly.
That makes sense.
It allows you to advocate for yourself and ask better questions,
Right.
but knowledge is power on a bigger level too.
Okay.
We can also use our voices to push for broader systemic change.
Okay.
That could mean contacting our elected officials to raise concerns about drug shortages or unfair pricing practices.
Right.
We can support organizations that are fighting for affordable and accessible health care.
Okay.
Even just talking about these issues with friends and family can help raise awareness.
So it's not just about being a passive patient.
Right.
It's about being an active participant in shaping the healthcare system.
Absolutely.
The saline saga is a perfect example of why that's so important.
It is.
Healthcare isn't just a personal issue.
Right.
It affects all of us.
It does.
You know, you mentioned earlier how the science behind IV fluids is more complicated than we might think.
Yeah.
We talked about osmosis,
Uh-huh.
but maybe we can dive a little deeper into that.
Sure.
Why is maintaining the right concentration in our blood so crucial?
It's all about keeping our cells happy.
Okay.
Our cells are incredibly sensitive to changes in their environment. And one of the most important factors is the concentration of solutes,
Right.
things like salts and sugars,
Okay.
in the fluid surrounding them.
Gotcha.
This concentration difference creates a force called osmotic pressure,
Okay.
which basically drives the movement of water across the cell membrane.
Okay, so if there's a higher concentration of solutes outside the cell, water will flow out to try and balance things.
Exactly.
And if it's higher inside, Water rushes in.
You got it.
Okay.
Now think about what happens if you introduce an IV fluid that doesn't have the same concentration as our blood.
Okay.
If it's too concentrated, it's like putting a raisin in a bowl of salt water.
Right.
It'll suck water out of the cells.
Yeah.
And they can shrivel up and stop working properly.
Yikes, not good.
No.
And on the flip side, if the IV fluid is too diluted, what happens then?
Then it's like flooding the cells with water, causing them to swell up.
Oh.
In extreme cases, they can even burst.
That's pretty vivid image.
It is.
So saline, being isotonic to our blood,
Yes.
helps prevent these problems by maintaining a stable balance.
It does.
Oh, like Goldilocks, not too concentrated, not too diluted, but just right.
Love that analogy.
It illustrates perfectly why using the right type of IV fluid is so important.
It does.
It's not just about delivering fluids.
Right.
It's about keeping that delicate internal balance so our cells can function properly.
Exactly.
It's amazing how much we take for granted when it comes to even basic medical procedures.
It is.
So saline is crucial.
Yes.
But it's also prone to these price gouging and shortages.
Right.
Are there any real long-term solutions to these problems? It can't just be a constant cycle of crisis management.
You're right.
Yeah.
And the experts we've been looking at seem to agree that we need to address the root causes.
Okay.
One big area that needs attention is increasing transparency in the saline supply chain.
Okay.
Remember those middlemen we talked about?
Yeah.
The GPOs and distributors?
Yeah. They sound like they have a lot of power in the system.
They do.
Yeah.
And some experts argue that hospitals need more power to negotiate prices directly with manufacturers, cutting out those middlemen and their markups.
All right.
Others say that more competition in the market for saline and other essential medical supplies would help drive down costs.
So breaking up the monopoly and giving hospitals more bargaining power.
Yeah.
That makes sense.
It's definitely one potential path.
Okay.
Another important solution, especially in light of those global shortages,
Yeah.
is developing more local manufacturing capabilities.
Right.
Countries that rely heavily on imported saline, like Australia, are especially vulnerable to supply chain disruptions.
Like you said earlier, healthcare security is national security.
Exactly.
Okay.
By investing in domestic production of essential medical supplies,
Right.
countries can become less reliant on foreign suppliers
Wow.
and have a more stable and reliable supply chain. Plus, it boosts local economies and creates jobs.
Yeah. So it's a win-win, better healthcare security and a stronger economy.
Yeah.
That seems like a no-brainer.
It has a lot of advantages.
Yeah.
Of course, setting up domestic manufacturing takes money and expertise,
Right.
but in the long run, it can have huge benefits for public health and economic resilience.
Well, it definitely sounds like there's a growing awareness of these problems.
There is.
And a push for more sustainable solutions.
There is.
But it's going to require a lot of collaboration and innovation
Yeah.
from governments, healthcare providers, and the public
Uh-huh.
to really solve these challenges and make sure that essential medical supplies like saline
Yeah.
are available and affordable for everyone.
Exactly.
This deep dive has really opened my eyes to a whole world of issues I never even knew existed.
I know, it's fascinating.
Who knew something as simple as saline solution could be so complicated?
Right.
Sometimes the most mundane things can lead us down the most fascinating rabbit holes.
They do.
Okay, so we've covered the basics of saline,
Uh-huh.
the shocking prices,
Yeah.
the global shortages,
Right.
why it's so crucial scientifically,
Yeah.
and some possible solutions. Anything else we should touch on before we wrap up this deep dive?
You know, I think it's worth circling back to what we were talking about earlier.
Okay.
About patients being more proactive in their healthcare.
Right.
There are a few specific things we can do to advocate for ourselves and push for change.
Okay, let's get practical.
Okay.
What are some specific actions we can take?
Well, remember that hospital price transparency rule we talked about?
Yeah.
It's a good starting point.
Okay.
It might be clunky and confusing,
Yeah.
but it's a tool we can use.
Right.
Start by checking if your hospital is actually complying with the rule and publishing their prices.
Okay.
If they're not, call
Yeah.
them out on it. Then when you get a bill,
Yeah.
don't just blindly pay it.
Right.
Scrutinize it.
Okay.
Compare it to the published prices.
Hmm.
And don't be afraid to ask questions if something seems off.
So it's like being a detective with our medical bills.
Exactly.
Look for inconsistencies.
Yep.
And if something seems fishy,
Uh-huh.
don't be afraid to raise a red flag.
Exactly.
And sometimes it might even be worth shopping around for certain procedures.
It might.
Especially if you have a high deductible insurance plan,
Yeah.
call different providers.
Uh-huh.
Ask for price estimates.
Right.
And see if you can find a better deal.
Yep.
You'd be surprised at the price differences that can exist.
You would.
That's a good point.
Yeah.
We shop around for everything else.
Right.
Why not healthcare, too?
Exactly.
But what about those situations where you need emergency care?
Right.
And you don't have time to compare prices?
That's a tough one.
Yeah.
Emergencies are tricky because you don't have the luxury of choice.
Right.
But even then, you can still be proactive afterward.
Okay.
If you get a bill that seems outrageous,
Yeah.
don't be afraid to negotiate with the hospital.
Really?
Explain your situation and see if they're willing to work with you. Sometimes they might be open to lowering the cost or setting up a payment plan.
So it's about being assertive and knowing our options.
It is.
Don't just assume we have to accept whatever the hospital says.
Right.
But beyond dealing with individual bills,
Yeah.
you also mentioned advocating for broader systemic change.
I did.
What does that look like in practice?
It can take many forms.
Okay.
For starters, we can contact our elected officials and let them know that issues like drug shortages and unfair pricing are important to us.
Okay.
Let them know that we want them to prioritize policies that promote domestic manufacturing of essential medicines, increase transparency in the supply chain, and make healthcare more affordable and accessible.
So flex our democratic muscles.
Yeah.
Make some noise, and let our representatives know what matters to us.
Right. We can support organizations that are working to fix the broken parts of our healthcare system. There are groups out there fighting for price transparency, negotiating power for patients, and policies that support local manufacturing.
Right.
We can donate to these organizations, volunteer our time, or simply spread the word about their work.
It sounds like there are a lot of different ways to get involved.
There are.
Depending on our time, skills, and interests.
Exactly.
And you mentioned something earlier that I think is really key.
What's that?
Educating ourselves.
Oh, yeah.
The more we know about these issues, the better equipped we are to advocate for ourselves and make informed decisions.
Absolutely.
Knowledge is power.
It is.
We can read articles, listen to podcasts like this one, talk to our doctors and nurses, and just generally stay curious about how our healthcare system works.
Exactly.
The more we understand the complexities, the better chance we have of pushing for meaningful change.
We do.
Well, I think you've given us a lot to think about.
I hope so.
And a lot of concrete actions we can take.
Good.
Who knew that a simple bag of salt water could spark such a deep dive into the state of healthcare?
It's amazing what you find when you start digging.
It is.
Saline is just one example, but it reveals so much about the larger forces at play in our healthcare system.
It's a great reminder to never take anything for granted.
Right.
And to always stay curious.
Couldn't agree more.
So to wrap things up,
yeah,
what's one key takeaway you hope our listeners will remember from this deep dive into the world of saline solution?
I think the most important message is that even something as basic as saline is entangled in a complex web of economic, logistical, and scientific factors.
Right.
It shows us how vulnerable our healthcare systems can be, but it also highlights the power we have as individuals to advocate for change.
Yeah.
Whether it's scrutinizing our bills, contacting our elected officials, or simply staying informed, we can all play a role in shaping a better healthcare future.
Well said. Thanks for joining me on this journey.
My pleasure.
And to our listeners, thanks for tuning in.
Yeah, appreciate it.
Until next time, stay curious and stay engaged.